Hi everyone, my name is Dr. Pinakin V Parekh. I am the founder and medical director and senior consultant at Trident Heart Center. I'm a general cardiologist and my subspecialty focus, my subspecialty interest is that of interventional cardiology. It sounds like a very big, complex, convoluted term, but what it really means is using minimally invasive methods to gain access to the heart and try to clear blockages that can cause symptoms in patients, such as most notably chest discomfort. And sometimes some of these blockages can suddenly rupture and progress so rapidly, and they cause symptoms like heart attack when it becomes 100%. So that's where an interventional cardiologist like me comes in to help patients with procedures like this. And I just am drawing from a patient I treated yesterday. He was only 44 years old and he presented with a similar emergency with chest pain at his workplace. He had a massive heart attack and we had to go and perform one of these procedures. Patients are getting younger and younger. Patients with coronary artery disease are no longer profiled to just be in their 60s and 70s and 80s. It's no longer just an old person's disease. In my field of practice, I'm seeing younger folks getting affected by such conditions. And there are multifactorial reasons. Our lifestyle has changed a lot. Back in the day, we used to eat more conservatively at home, but now everyone's eating out. Our diet has changed. We are living in a stressed, fast-paced society where blood pressure, eating habits can be unchecked. Physical activity seems to be very limited also. There are a lot of people, when I ask them, what's your physical activity regime like in a week? And it's practically non-existent. Another thing I like to mention also is a lot of us in the bustle and the hectic pace of life do not really upkeep our health by getting regular checks. We want to do it, we want to find the time, but it always takes a back seat because there's some other agenda that needs to be placed first. Family, work, but health always seems to be taking a back seat. I see patients, when I see them in a consult room like this, when I ask them, sir, thanks for coming today. When I'm trying to delve into their symptoms even more, I ask them, do you have any background medical history? And then they'll say, no, doctor, I've got no medical problems at all. I'm fit as a fiddle. And then I follow up with another question. When's the last time you did blood check? And then say, oh doctor, I've never done any blood checks in the recent memory. So that's an important point. If you don't check, you will never know some of your cardiovascular risk factors. Most cardiovascular risk factors, high blood pressure, diabetes, cholesterol, are silent. They will not have any physical appearance. They will not cause symptoms. They are all very silent and only detected biochemically when you draw a blood sample or if you get your pressure measured. So always try to get some form of health check screening wise done once you hit a certain age, and typically what we advocate is at the age of 40 and above. If you have a family history, parents, siblings getting affected by heart attack, stroke, all these cardiovascular problems, get yourself checked earlier. There's another subgroup of patients who are underserved. When I say underserved, meaning they are not really in the front line, in the limelight when we discuss cardiovascular problems. These are post-menopausal female patients. Once a female patient has menopause, her cardiovascular risk profile changes a lot. The drop in estrogen hormones are protective. So the drop in estrogen hormones will increase your cardiovascular risk profile. And that's where, if you've never had time to check your health before, once you've attained menopause, that's a good time to take stock of your health and get in for a check. And then there are a lot of things we can discuss, whether it's hormone replacement therapy to help you with some of your symptoms for menopause, which have some benefit on cardiovascular health also. So another important aspect is recognizing symptoms. Yes, sometimes you will develop some symptoms and you wonder, is this something I should take note of or something that I can bury under the blanket and wait for a few more days? Cardiovascular symptoms, typically, number one is chest problems. And it's not always chest pain. You know, when I ask patients, do you have chest pain when you walk? Do you have chest pain when you climb stairs? And then they will say, no, it's not chest pain. But let me draw attention. Chest pain, chest pressure, chest discomfort, chest dullness, chest heaviness are all descriptions of the same entity. So if you have one of these things, you should get to a doctor. It can be a primary care physician, it can be a cardiologist, or anyone who has some way of trying to understand your symptoms even more. Sometimes symptoms are not so apparent. It can be a bit more vague. Breathlessness, giddiness, tummy ache when you eat, fullness in the tummy. Doesn't sound too significant, but it can be an underlying sign. So that's why it's always very useful to go and see a doctor, and he or she will be able to do some tests, be it a basic ECG where you put some electrodes on the chest to look at the rhythm of the heart, to try to uncover what's the basis of your symptoms. In my line of practice, I've had a lot of near saves or near misdiagnosis where patients have stomach ache, they think it's a gastric problem, but it turns out to be a heart attack which was brewing all along. And by getting an EKG or ECG done, that helps to delineate what is what. So there are a lot of tests to try to help evaluate the heart, but I think one of the most important tests in current generation of cardiology is the usage of CT scans to look for blockages from outside the body. It's called a CT coronary angiogram, and it's frequently paired by an add-on test called a CT calcium score. And when you detect a blockage on a CT scan, there's a few things can go ahead. Number one, a doctor will need to really delineate how bad the blockages are, and if it's significant enough, we need to bring you to the lab to do an angiogram to confirm the blockage that was detected on a CT scan. And as an interventional cardiologist, there are many tools now we have to further assess the nature, the severity, the composition, the length, the size of the blockage by using imaging tools, by using measurement tools before we do an angioplasty. Of course, if it's 99%, 90%, if it's clear cut, then no questions asked. But for the gray zones, for the borderline blockages during the angiogram, sometimes there's some of these methods which I mentioned, which I do to really justify whether a stent is needed or not, so as to give you the best outcomes possible in the long term. So one of the advices which I commonly give patients is that never belittle your symptoms. In my line of work, I've seen many things, and one of the most painful things for me to see is you've had symptoms going on for a few days, you've not had time to address it, and it then comes to a stage where it can be too late. So it's always very useful. I know it takes effort to see a doctor, it disrupts your schedule, but it is always very useful, take it from me, to always get an opinion from a doctor just to make sure you are safe and heading in the right direction. I think I cannot belittle this point. It is very important, and this is the same advice I've been giving it to patients over and over again for a long time.